Today's presentation is on Neisseria meningitidis, which is known to cause the disease meningitis. It was first discovered in 1887 by Witch Sailbaum, who had analyzed the cerebrospinal fluid of a patient that had been infected with the disease meningitis. It's been around for roughly 135 years, and our understanding of this disease has grown significantly, and we've been able to recognize that meningitis is inflammation of the meninges, which are three protective layers that cover the brain and spinal cord. More specifically, the inflammation of two inner layers referred to as leptomeninges. From there, we've been able to have the help of vaccine campaigns, which have helped significantly in reducing complications. It's found worldwide, however, in certain regions more than others. General characteristics include prokaryotic, aerobic, or facultative anaerobe gram-negative diplococci, non-motile, non-spore-forming, and attacks the membranes that protect our spinal cord and brain. Morphology, it's aerobic gram-negative diplococci, can occur intracellularly or extracellularly in certain types of immune cells. It's fastidious, and its reservoir are only humans. And geographically, meningitis outbreaks occur worldwide, unfortunately. However, the highest instances of this disease is in what's called the meningitis belt, which is sub-Saharan Africa. On the right is a map that highlights that region of that belt. A question to think about throughout this presentation are maybe reasons why Africa experiences the highest risk of meningitis. Transmission of meningitis is, the reservoir is the human nasopharynx, but modes of transmission are through direct contact and large droplet respiratory secretions or saliva, therefore requiring close contact to spread the bacteria, like coughing or kissing. In the nasopharynx, the bacteria multiply and bind to specific receptors and are taken up by epithelial cells, which transport the pathogen across the mucosal epithelium. Virulence factors, capsule, which helps survive the human immune response to the pathogen, pili, which aids as the adhesion factor, LOS evokes the human immune response, which leads to endothelial damage, capillary leakage, tissue necrosis, and organ failure. And then human factor H binding proteins also assist the pathogen to survive the immune response, negatively relating the complement pathway of the immune system. Major signs and symptoms include high fever, stiff neck, severe headache, nausea, vomiting, confusion, and many more, but those are the most common. Incubation period is typically 3 to 4 days, but can range 1 to 10. Symptoms, once treated, range from 5 to 7 days, and recovery can take 2 to 4 weeks. Untreated can be fatal. Complications can include brain damage, chronic pain, skin scarring, hearing impairment, visual impairment, motor function impairment, and then several others like arthritis, brain damage, coma, all that. Possible medical treatments that are necessary are antibiotics, and the measures that can be taken to risk the infection is vaccination, according to health professionals. Antibiotics help kill the pathogenic bacteria, which lowers the progression of the disease. There are two known vaccines, one meningococcal ACWY vaccine, which is a series, and following that, you'll then get a booster every 5 years, and then Men-B vaccine, which is also a series, and you'll have a booster every 2 to 3 years. Who's infected? Anyone that comes in contact with an infected individual. It's estimated that 1.2 million cases worldwide per year occur. On the right is a graph, and you can see it fluctuating from years 1970 to 2019 in the United States. Risk populations include infants, adolescents, people exposed to crowded environments like college students or Marines, people living in the meningitis belt, and people with HIV. Unfortunately, anyone can get the disease. Vaccines do reduce the risk, though. And then the answer as to why Africa has higher numbers is because it is a favorable environment for the pathogen, so dry and dusty conditions, travel and large population displacements, and crowded living conditions. My prediction of any future threat of this disease, I predict it to improve just because science and research more specifically has exponentially improved, but I do see it continuing to linger in places like the meningitis belt. And that's it.